Welcome to this educational video on the lumbar spine or the low back from Physio Fitness in Maidenhead. So if we take a look at the skeleton, we can see this area here is the low back or lumbar spine. So at the top of the lumbar spine, just actually into the thoracic spine here, are the ribs, which form this upper part of the lower back. The bottom part here is the pelvis, so that's the top of the hips and pelvic region. This area in the middle is the sacrum, okay, leading right down to the tailbone, right at the bottom there. So if I come up into that low back region that we're going to talk about today, we can see that there are 5 lumbar vertebrae or 5 bones in the lower back. We have 1 here, 2 here, 3 here, 4 here and 5 here. So there are many different levels here, and on each of these levels there is a joint at either side. Right in those regions there, you can see that right down there. That is one of the joints, and they are either side as we go up and down the low back. So this is looking from the back to the front. If I turn the skeleton round to the side to start with, what we can see is that there is a slight curve in the back here, this way. This is a lumbar lordosis or lumbar curve, and that is a normal shape for the lower back, a normal lumbar curve. Okay, you can see the top of the hip bone or the pelvis and the bottom of the ribs, they're quite close together on the outside. If we move around to the front now, here we get a clear look at the discs. These are the discs at each level in the low back. Okay, and this bottom disc you can see right down here, that's the lowest of the discs in the spine. So the yellow bits now on the outside on this skeleton, these are the nerves. Okay, and each level again has a nerve that passes out from the lumbar spine. These nerves at the front here on the top part of the lower back form the femoral nerve, which goes down the front of the thigh, and the lower nerves at the bottom of the spine form the sciatic nerve that goes down the back of the leg, and these are the nerves that are irritated with sciatica. So a lot of people come to clinic and say to me that their disc hurts when they press it. Now we can see clearly from this spine that actually that can't be true, and what they're feeling is not that the disc is painful when they press it, because if I press someone's back here on each one of these spinous processes, okay, if I press it here and then I move the skeleton round to the side, we can see how far away we are actually from the disc. Okay, the disc is right here in the front part of the lumbar spine, and we have to get from this region all the way to here to actually press on a disc. So that is the disc that comes around there. So we can't physically press the disc, because from the front we have our stomach contents, and from the back we have the spinous processes, these thick bones at the back, and at the side we have these spinous processes that come off the side. These ones, because they're at the side, are called transverse processes, because they run transversely off the spine. So when we press here on the transverse processes, there's a thick layer of muscle between these bones and the skin. So again, you have to get through that in order to be able to get down to this region here. So that is how the spine looks. The spine can bend forwards, it can bend backwards, it can rotate from side to side, and it can side bend from side to side, and it can do a combination of all these movements. So when we look at the lumbar spine, there are lots and lots of complicated little areas that have the potential to cause pain. Now, when I see most people in clinic with low back pain, the main question they want to know is what is actually causing their low back pain. Now, when we look at this, it's actually the same as any other joint in terms of you can have pain within the joint itself, and either side of these joints are ligaments, and at the front there's ligaments, at the side there's ligaments, at the back there's ligaments. So there's lots of surrounding ligaments around your lumbar spine that hold it physically in place, and those ligaments can cause pain as well as the joints causing you pain. You can have muscular pain in the back from the muscles that run up and down either side of the spine and the muscles that come round the front, and there's also lots of little tiny muscles that run in between each of these areas of the low back. When we rotate round to the front, we can see obviously the disc here, which is a bit of an exaggeration really of a disc bulge or a disc prolapse. And disc pain in the lumbar spine is not hugely uncommon, and discs can press on the nerves and they can give you radiating leg pain. Now, you can have a disc that causes pain by itself. You can have a disc that causes pain in conjunction with a nerve pain that then travels down your leg. Or you can have nerve pain that is caused from flattening of the joints in this region here that also compress on the nerve. And also you can have just specific joint pain, or just specific muscle pain, or just specific ligament pain, or a combination of these. Now, this is where the lumbar spine is so complex, in that it doesn't always and rarely is one structure that is causing the problem. It's normally multiple factors that will cause you pain. Because of the complexity of the low back, you often find that it will be called non-specific low back pain, which means that one definite cause cannot be identified, which is quite frustrating really. But unfortunately, that is just how complex the lumbar spine is. And even with MRI scans, it's important to note that MRI scans will give you a picture of the low back. So they may well show that you have a disc problem where, let's say, for example, a disc is bulging. But what we need to realize with low back MRI scans that do show disc problems is that that doesn't always have to be the cause of pain, because in studies they've shown that when they MRI scan asymptomatic subjects, so these patients have never had back pain in their lives, they find that over half of them have a disc bulge that is identifiable on MRI scan. So over half will have a disc bulge, but they've never had back pain. So what we're saying by that is that just because an MRI scan shows a disc bulge does not always mean that that is the cause of your pain, which again is quite frustrating. But what we do in clinic is we put together a picture. We look at how you bend forwards, how you bend backwards, how you bend from side to side, and how you rotate. And then we look at how you functionally move with maybe squatting and lunging and lifting and all various different functional things. Then we put together the picture from the pattern of pain that you present with, and we come up with a diagnosis of what we think is the structures or structure that is causing your pain. But it is a complicated process, and that's why a thorough and detailed physical assessment of the back needs to be conducted in order to actually ascertain what the cause of the problem is. So I hope you found this video helpful on the lumbar spine, and you found it useful to see what the lumbar spine actually looks like. And hopefully you can stay free of low back pain.